welcome everybody. We are so excited to have you here for the 2023 Life Sciences Trends Impacting Salesforce. There are so many things happening in our industry that are wonderful, powerful, interesting, frightening, and our facilitator, Eric Dreshfield, who is a Salesforce MVP in the Salesforce Hall of Fame, who really cut his teeth in the life sciences industry, is going to be leading our wonderful panel of experts from the life sciences industry today. That includes Scott Ballenger, Robyn Goldstein, and Tarra Shingler. He's going to be asking them questions about things that are happening in the life sciences industry and how that's going to impact Salesforce. He's going to be digging into those. We also have our chat and Q&A buttons open, so you please feel free to write your questions inside of there, and we'll make sure that we surface them up at the end. And if it's appropriate, we'll pull them up during the middle. We are pleased to have you here today. This is part of our Life Sciences webinar series. We are running on the third Thursday of every month. We've got a few more coming up in winter, early spring. Then we've got a live road show. We will be having lunch and learn panels in the cities of Philadelphia, Boston, and Research Triangle Park in the spring. And that is leading up to something I am very excited to announce to you. In August, we will be hosting a 2-day conference in Florida called Life Sciences Dreamin'. It is ideal for those of you that are in the go-to-market positions, such as sales, revenue operations, marketing, and executive management, to learn more about the sales and marketing technology landscape in the life sciences profession. We cannot wait to give you more details on that. Everybody who attends one of our webinars is going to receive an email that gives them a code to attend one of these, any of these sessions. And so you should be looking forward to that. Also, anybody who attends today's webinar, we will be sending you a really nice holiday package. If you DM me your address, we will make sure that we get that out to you. We've got a little gift for all of our attendees, and I can't wait to send it to you. I am not going to waste a bunch of time because I can see we've got loads of people that are joining us. So Eric, welcome to the stage and have a lot of fun with our panel. I can't wait to hear what you guys get into.
All right. Thanks, Shannon. Well, let's start with simply going around the room and doing introductions. Scott, let's start over with you. Tell us a little bit about yourself and why you're here.
Hey, everyone. I'm Scott Ballenger. I'm in Philadelphia, and I have been selling innovations and solutions into life sciences for over 25 years. So I want to bring that perspective to this group, and I'm looking forward to a good discussion. Thank you.
Awesome. Thanks, Scott. Tara, how about yourself?
Hi, nice to meet everyone. I'm Tarra Shingler. I'm an SVP of Global Business Solutions at StudyKick. I've been in the life sciences industry for over 20 years, for about 14 years, consuming technology and putting research out on the sponsor side. And almost the past 10 years, I've been on the technology sales side, selling it. So excited to bring my perspective to the chat today.
Awesome. Thanks, Tara. And Robyn, how about a little bit about yourself? Robyn, you're still on mute. Sorry.
Thank you for that reminder. My name is Robyn Goldstein. I'm the Senior Director of Commercial Operations at Vector Laboratories. I have been working with the life science industries for a little over 20 years. The first 10 years or so was more of a support role. And in the past 10 to 12 years, I've been more on the technology end and working directly with companies who are getting things out to market.
Fantastic. Well, let's start with a future-looking question. Thinking about 2023 and the workforce and the tech stack that's available right now, what kind of thoughts do you have on the life sciences industry as a whole? How is the demand in the workforce, and what can companies do to utilizing their tech stack to better attract and retain the right employees? Robyn, why don't we start with you?
Okay, I'm going to start with the basic concept that I tell all my people. I want to automate what doesn't need a human, and I want a human for what can't be automated. And so really what we are looking for is, what tasks do you have your teams doing? Doesn't matter what team it is, that really doesn't need them. You know, for a board slide, she gets to just go and touch something because it's there, and it doesn't involve you needing to to have a human create it for her, for example. So that's really where we need to go, is listen to your people, automate what you can so they only work on the high value items.
Awesome. Sounds great. Scott, anything to add to that?
I agree with what Robyn said, and automate, following automation, amplify. Where can we use the tech stack to amplify some of these activities that we're doing? And let's break the sales cycle down into its discrete steps and functions and look at where technology supports each of those. What are those best practices? But automate, amplify, and try to find leverage through your technology. Sounds
awesome. Tarra, anything that wasn't said yet that you can add?
Yeah, I have a little bit of a different perspective. I absolutely agree with all of those points. But I think in hiring and sort of the in the life sciences industry previously, when I used to interview many years ago, it was always, do you have a life science degree to come into this industry? That has completely changed. I do a ton of interviewing now. And I'm looking for folks that don't have a life science degree, or sometimes a combo, or somehow came into the industry with a different perspective. What I found in the past, almost 10 years on the tech side, that combination of folks of outside thinking and inside thinking coming together is absolutely brilliant and powerful. And some of the ideas that some folks that some of our outside folks come up with versus our life science focused folks are really fascinating. So that's really where my position stands. Let's look at everybody, and I see that a lot of folks in the industry now are very flexible. They're asking, what tech stacks do you have? They're asking very different questions before they make a decision to make sure you are tech savvy and you're giving them the tools that they need. And if they don't have the background in that specific tech stack, they will go and learn it very quickly and get certified in it. So I think we're in a really interesting place in 2023 and beyond for growth, continued growth with all of the technology advances that we're bringing to our industry.
Awesome. Thank you. That's fantastic. So basically, to kind of summarize this first question, automate what you can, try to keep the human out of it where it makes sense. Consider various tools and options, even if you're just simply road mapping, and then consider the alternative views on education where technology might be more important than the actual industry, perhaps. So that's cool. Let's move on a little while we're still kind of talking tech stack here. Let's move to what some people might refer to as the app gap, where there are things out there that seem to be missing. So thinking about your marketing, your sales professionals in this industry, what do you feel is kind of out there? Or what do you feel is not out there that perhaps should be? What's missing from the tech stack? What kind of unmet need is out there that might make your job or other people's jobs on your teams easier? Tarra, let's go back and start with you this time.
Yeah, so there are a lot of areas I could go with this one. I think as much as we introduce, tech, as we were talking about, we automate, but we still need that human element. And I work in a very digital social tech environment right now, and we deal with patients directly. And so as much as we put technology and algorithms and AI learnings towards what we do to be smarter, the human element still plays a very strong role, especially when we're dealing with human interactions. Folks still want to be interacted with. We're not robots. So in terms of internal tech stack, we are an innovative company, and we build off of our own tech stack. So if I have an idea, I come up with it and my team can build it. So I don't have a need in my current role from, a Salesforce role and some of the life science components. I think continued, flexibility, listening to customers. I think there's a lot more AI learnings and analytics that can continue to be added to the industry to help us, day over day, month over month, year over year. And I know Salesforce does a great job of listening to their customers, as well as, many of the life science companies out there. But, life sciences is a little bit of a different beast from some of the other industries. So I would say continuing that listening and carrying that forward as they develop new products.
Fantastic. Thanks, Tara. Robyn, how about you? Comments on that? Oh, and you're muted still.
Sorry,
There
my
we go.
unmute did not work. So I think that frankly, all of us who have Salesforce have most of the tech deck we need, but we're not using it. And I think we need to keep our mantra is Excel is not a database. All of that data that goes through Excel, and I'm doing it too, so I keep telling myself this, all of that data needs to flow into Tableau. You've got a Salesforce subscription, you've got Tableau. Tableau is there for us to take all of our different data sources, regardless of what they are, mingle them together, and then that executive or that program manager at 2 a.m. needs to pull something, it's all there. It doesn't need to be manually handled. Excel does not like large numbers. I've got a couple of spreadsheets I'm fighting with. And again, it's making it a la carte. So I think that a lot of us have what we need. We're just not doing what we should.
Okay, totally makes sense. Yeah. Scott, anything else?
Yeah, to follow on what Robyn said, I hear a lot of life science sales teams say that their tech stack is their second biggest expense behind their payroll for their team. So the tools are there, the investment's there. But what I do see in terms of this app gap is sometimes we're state of the art at certain parts of the sales cycle. And then to Robyn's point, not using what's available at some point in the sale. And we hit with a thud, like a total 1.0 proposal document versus what could be afforded through some of the technologies that are there and already integrated with Salesforce.
Awesome. Yeah, I remember many, many years ago doing everything in Excel, and that's probably the way a lot of people did it. And sadly, there's probably still a lot of organizations that do a lot of that. Needs to be rectified for sure. All right, let's see. Next question. Let's talk a little bit about capital funding, venture funding, and things that can be done to help properly increase the research and provide funding for the companies that are doing all those awesome things. So thinking with that in mind, what are some of the things that life science companies can do from this perspective of searching for funding sources, whether that's through foundations or nonprofits or even partnering with universities? What are some of the things that maybe they should consider, and how should they go about attacking those? Scott, let's go back to you for this one for starters.
Sure. Well, it's an expensive industry that we're in. The work that we do is costly. So these funding sources, private, public, grants, all those types of things are very much a part of the landscape. And where the teams that we're talking to today can be diligent about that is keeping good records, because the questions that come with a partnership, with a funding, with investment, with mergers and acquisitions are going to be extraordinarily granular and at the product level, the customer level, the product with the customer level, and in the mix of all the different types of due diligence questions that come with a financial partnership, and keeping the system of record, Salesforce, the CRM, the system of record up to date. Those questions will be unending until the partnership is done, and using the tools that you have to have that level of granularity and expect that type of due diligence is just going to be table stakes for raising money.
Sounds good. Robyn, any thoughts from you on that?
I'm going to go back to a lot of it is integrating your systems. And the reason why is regardless of whether it's Series E funding or it's a grant we're trying to go for, a lot of the information is the same. But we also have to keep a lot of that information confidential, because you don't want just a random salesperson going into Salesforce, finding that information. So using Salesforce to lock certain types of data to, let's say, the executive team or to the sales team or whatever. And then again, having it all flow into a system like Tableau and pulling it all together. Because I mean, right now I manually do all of our business to business catalogs, for example, but there's no reason I can't have, and we're moving it to Salesforce. There's no reason I can't put the data in there, build the report, click a button, and then that's automated for me. And that's the same thing is if you're gonna start working on another grant, you don't want to start from scratch. So you need to lock certain data down. You need to feed it into whatever system you want to do as a system of record, and you need to amalgamate it. And then you can use that to create your next steps and not start over and over again.
Sounds good. Tarra, some thoughts from you on this?
Yeah, kind of to go back to Scott's point, for some of the early on companies, I speak with a lot of these companies to evaluate just what their technology is, if it can be integrated, incorporated, where they are in their development cycle, where they want to go. And as I had noted earlier, a lot of the companies coming in to the life science industry or from outside the industry and solving problems for us that, we didn't know how to solve ourselves. So sometimes they don't understand the regulatory requirements, some of the strict rules when we're dealing with agency level data. So that's, part of my response is, making sure they do understand what the requirements are and having a good advisory board to guide you through those sorts of things with some industry background. That'll really help your product be solid when you're going through a lot of the due diligence components. You might not have everything fully baked, but a good basis will get you a long way. And then, if a company is willing to invest in you, they're going to be willing to validate and do the necessary work to take you to the next steps. And that advisory board, so I sit on a number of those for companies that are coming into the industry. How do you set up sales teams? How do you sell within the industry? How do you get your first client? How do you get, large pharma, mid-sized pharma, small pharma, biotech to sign on to your product when you're a new shiny bauble? And so, providing that value upfront and figuring out what that value is. A lot of the companies now are, bringing their products early on and coming to innovation showcases to really show what their products can do and generate that interest. Again, they might not be fully baked. And that's where you can really generate a lot of interest. A lot of industry folks come to these innovation type showcase meetings. So I really would suggest, getting yourself involved in those early on and start taking that feedback as you build through your product life cycle. And typically your first product that goes out is probably not your product that you're going to, eventually, market or launch with. And it goes through many iterations, but you'll get some great feedback. I feel our industry is always willing to give folks feedback and typically helps you develop that end stage product.
Awesome. I think some of that are trends that you see no matter what the industry, as far as developing a product and how it should get started and the things you need to do to go after customers. Diving in on this one just a little bit deeper, I'm curious if any of you three have some thoughts on the very new startup. Should they focus exclusively on smaller organizations as potential customers early on, or should they target the big whales and try to go after those large organizations as well? Tarra, it sounds like you have something to say already.
I have some personal thoughts on it. So, it really does depend on, the corporations or, the tech companies, mantra, and they need to, figure out what their end goal is going to be. Going with the large companies, you get a backing behind you. And there's something to be said for that. If you get a top 20 pharma to sign on to your product, you can work with them, co-brand it oftentimes. You could maybe create a registry or, do something creative. A lot of the large pharma companies are looking for investment and to help you build products out. So my current situation, that is, the process that they took, and many of our new products that have come to market have been feedback from companies like that. And, sometimes they have, digital checkbooks that are much larger to invest in technology than some of the smaller companies. So, we can't argue with that. Smaller biotech, again, I think they'll be very partner driven. Oftentimes we'll give you feedback, but it might be a little bit more hand holding because they have very limited resources in your tech or digital, whatever you're trying to do. So it might be a co-investment. You might be, giving them the first, vantage point for free. If you're launching a new technology, saying, hey, use this on a study for free, give us feedback. If it goes well, then maybe we can create a partnership. So I think there's a lot of different ways you can work it, just depending on, what your take is on the industry and sort of, what your company goals are.
Fantastic. Robyn or Scott, either of you have any additional comments on that?
I'd follow on and agree with a lot of what Tarra was saying, but also too, the sales cycles are going to be different. So, the adoption for a large pharma, you're going to need a little more runway for a longer sales cycle because they're so methodical in the way that they bring new partners and new solutions on. Whereas biotech companies, your access to senior decision makers, their decision cycles, they're running on a tighter budget, so they're making decisions faster. So take that time element in as you think about new product and adoption. And there is a very, very long tail of biotech companies looking for solutions beyond the top 20 pharma. And some of the latest data on that is there 60% plus of the current pipeline is coming from that long tail of biotech. So there's plenty of opportunity there and possibly a faster sales cycle. But everything Tarra said still holds true.
Yeah, really
Fantastic.
Great point.
Yeah, Robyn, anything to add?
So I agree with both of them, but the other thing I'd add is who's your key opinion leader for what you're trying to do? Which company is in that space you want to go to? Do they have a key person at a large pharma company that you need, their expertise, and they would have that way into the market you're thinking? So I think it's all of this combined, but it doesn't help to partner with large pharma if that's not something that large pharma is really working in. They might want to go into that part of it, but as a smaller company, do you want just the funds, or do you also want a partner who can bring in key people for you to talk to shape it, to make sure that whatever niche you're trying to go into, it fulfills that need?
Awesome. All right. So then, this really kind of goes into one other trend that I'm curious to learn some more about your all's opinion on. And that really has to do with the research and manufacturing angles, and whether outsourcing that to other organizations is a trend that seems like it's going to continue, and is it something that makes sense? Is there benefit beyond just pure cost savings to doing that? Let's start with you this time, Robyn.
Well, I won't lie, my last 2 jobs have been at a CMO and a CRO. So I'm well acquainted with this side of the business. And I would say that it's all about the specializations. What are you trying to do? Who has that expertise? And we'll work with our clients to make, for example, let's say a larger batch of one of our products for them, and that's custom. Or we can work with them to completely design a new product that they need to use. And so they're coming to us with our specializations to help them get what they need, because they're not going to be able to have all the specializations in-house. They're going to need that help. But at the same time, not all CMOs or CROs are going to be the right one for them to work at, because they do need to look into the whole, this is the specialization I need. Which one can provide that for me? Which one also, frankly, has good quality of products? Because you want that good reputation also, because that's going to help you be confident that the products you're creating with them and buying from them will actually fulfill your needs and give your clients the high quality that they are expecting from you.
Fantastic. Scott, how about you? Comments on that?
I think the outsourcing mirrors the way we build tech stacks for different companies that have different needs. And what Robyn said, that appetite for specialization is a real dividend for being able to outsource. And as we see the long tail of biotech, they're going to outsource until they reach a certain milestone or critical mass and have that expertise in-house. So it is a trend with a lot of staying power, a lot of growth prospects for that, and for what Robyn said about the ability to specialize in a market that's increasing in complexity, increasing in sophistication. I think these trends are going to continue, and where our Salesforce and other things can help us with that is a granularity of product offering, the different personas, the different market segments we're going to have because of that specialization.
Okay, thanks, Scott. Tara, anything you would like to add to this?
No, pretty much agree. Outsourcing trends are here to stay. Just, for all of no matter the size of the company that we work with, not every company can have, every single component of what they need to do internally. So, we do see different trends, year over year versus, 3 year, 5 year. There are trends of things that get outsourced versus insourced. And it is interesting to follow those patterns. And I've kind of seen it go, back and forth like a pendulum over the number of years they've been in the industry. But to Scott's point, I agree with the Salesforce component, creating more analytics, like you were saying, influencers, percentages of things that get outsourced versus insourced, so we can follow those trends a little bit closer. I know that data is out there. There are companies that put it together, but it would be nice to have it more, in the forefront.
So continuing on that really quickly, do you think that Salesforce, as the platform owner, for lack of a better term, almost has a responsibility to kind of aggregate all that data and provide those views in an I can't say it, an anonymous fashion?
I mean, they already pull in. So, I mean, I don't know if they have a responsibility, perhaps an option, like anything, because, giving options to folks that want that data, perhaps it's
Oops.
Following on her thoughts, the way I see it is an option as well, is the ability to house that type of data and have it at access. Like if I'm looking at Pfizer as a potential customer, I might like to see in the CRM who we know their preferred outsourcing partners are across the spectrum, and how do we integrate in that regard? Because in a sense, if we're going to work with Pfizer, we're going to work with some of their preferred suppliers as well. And having the ability for the CRM to be able to accommodate that type of information can be very useful.
That's a really good point, Scott. I think figuring out how to increase the collaboration across all the necessary parties, I think that really makes a lot of sense.
Yeah.
Robyn, how about you? Any thoughts?
I just want to add in that the collaboration of gaining that data and storing that data and working together is what's really important. So yes, we put it in Salesforce, but at the same time, and I'm going to talk about integration again, you integrate your data that's coming from your product team, from your sales team, you integrate that together so everyone can look at it, because the collaboration between the teams is what makes us stronger here, because we're not all going to know everything we need to know about these opportunities, or we're not going to know what the pitfalls are, because not all of us have dealt with it before. So having that well-rounded company with you, putting the data, as has been said, in Salesforce, amalgamating it through some kind of data warehouse or Tableau as necessary. But we've got to work all together. All of us at our companies have that information that we need, and that makes us to get a stronger solution.
Fantastic. That sharing of ideas and collaborating across companies, I think ties well with the whole aspect of the Salesforce community. I think there's a lot of that goes on organically to some extent within this community, as people just simply discuss what they're trying to accomplish and the problems and challenges that they're facing, and someone in their conversation just says, hey, I had that same thing, here's what I did, maybe that's an option you should consider. It's an interesting thought of competitors cooperating with each other, perhaps, is one way to think about it.
Well, and even what Tara said too about the diversity of team members on the go-to-market team, some from within the industry, some from the outside, they have run into, different types of challenges that we have, and they can bring, like you just said, Eric, they can say, this is how we've solved that previously. Maybe it'll work in this environment as well. So that collaborative team approach can build out, because a complex and sophisticated sales cycle for the most part for a lot of these solutions. There's going to be several handoffs within a company across that sales cycle. And then as you start to interact with the team, and even as there's turnover in this environment within your own team, having that good record system of record for each of those handoffs makes for a lot less turbulence.
Makes a lot of sense. Yep. Robyn, did you have some comments to add here?
Nope, I'm just nodding along. We're in
Okay,
agreement.
awesome. Shannon, do we happen to have any questions coming in at this point?
You know what? We do have some questions. So let me share the questions with you. Thank you guys so much. This has been such an interesting and fascinating conversation, and I love it. I think one of the things that we see a lot when we're thinking about Salesforce, particularly in the life sciences industry, is this is an industry of people that work with data all day long. So the requirements for Salesforce are so much heavier and headier because we know data. We're working with data. That's literally what we're trading on here. So I think a lot of the points that you guys brought up are fantastic. And the first question that I have is, a few of us have mentioned M&A a little bit. There's been some sort of hazy references to M&A. And so the question that I saw that I thought was really exciting was to ask about, whenever you're looking at this sort of environment, when you're looking at M&A, what do you think is something that you should be thinking about when you're thinking about Salesforce instances? So maintaining separate Salesforce orgs, integrating Salesforce orgs. What are the types of hesitations people should be thinking about? What are the types of things that they're looking at? So essentially, what type of experience should people who have not had this experience before be drawing off of when they're looking at M&A activity and Salesforce instances?
And hey, Shannon, I'm back. Sorry, my computer went haywire and kicked me off.
No worries.
So calling in from my phone. Gotta love technology.
Welcome back, Tarra. Shannon,
Yeah,
I'll start
thanks.
off and then Robyn and others can follow in. Like we started to say, the expectations and due diligence for a solid CRM, the pipeline is going to be something that's going to be critical to any type of M&A. What does the business look like? What does customer concentration look like of your revenue? How is it split out across your products? How is it split out across your customers? What does your sales cycle look like? All of those things are going to come right out of Salesforce, and you're going to need to have a ton of confidence if you're in leadership that that data is accurate, because it's going to make or break a due diligence process.
Yeah, great points. Oh, go ahead, Robyn.
Sorry, I was going to say I completely agree, but going a little more on that edge of what Shannon was asking, which is, if you're doing M&A, do you combine the systems or do you keep them separate? I have done both, and they both can be a complete mess, and they both can be really good. Well, but the thing is this: when you buy a company, are you looking to have the two companies essentially sell everyone's products, or are you looking to keep them separate? And so that's where you really need to look at it, is if there is the similarities, and if there is if you're going to have benefits from combining them, you should. And of course, it's cheaper because you don't have to buy multiple instances of everything, right? But if the companies are really, they might be in the same space, but are completely different, I would not merge them together. I would pay that extra amount, because you have issues where, for example, you'd have to worry about who can see data, because you might not want sales data, seen across both of those business units, right? If let's just use Pfizer for an example, maybe I sell into Pfizer into one division and someone else sells into another division, and then we're all fighting over the Pfizer, institution page, because we're trying to put in our information, and then someone else is trying to put in theirs. So I think you have to look at it from a aspect of, are you merging the companies, or are you buying someone to keep us separate? And if you're doing that second one, I wouldn't combine them, even though, as I said, there's an extra cost to it. But if you're planning to merge them all together, then I would put them together. And that allows the teams, by the way, to cross-sell. Even if it's an intra-company kind of product, back and forth, it allows the teams to cross-sell. It allows the company to put the revenue in the right spot. So combine companies, combine Salesforce. Keep the companies separate, keep Salesforce separate.
Thank you for hearing the question more clearly than I did, Robyn. And you're certainly in a great position with your experience to know the pros and cons of both of those. Yeah.
Yeah, completely agree, Robyn. Past 3 years, I've been in a combined situation and a separate situation. And I agree weighing the pros and cons, but I think your assessment is spot on with, if the products are competing with each other, it makes a lot of sense to get that organized in the same Salesforce. If the product or company that you're buying is maybe adjunct or complementary, it may make sense to keep it different because, as you noted, you might be selling into different units within Pfizer, or the parent company may be large pharma. You may have a stronghold in biotech, and so completely agree. But a lot of challenges with both. It's very disruptive to sales teams for sure. So I think that aspect really does need to be assessed. Something always goes wrong. Salesforce, I've been in situations where Salesforce hasn't been available for 2 weeks, and that's very disruptive if you're trying to drive, proposals and everything else out of it and contracts. So, it takes some assessment and definitely some consultation to guide you through that decision and process.
I love that. Those are amazing insights. Tremendous. Thank you so much. The next question actually is making me giggle because I told Eric today, I forwarded him the Good Day Bio email that came out that was talking about accelerated approvals. And I said, this probably won't come up today, but this is an interesting topic. And of course, somebody sent in a question about accelerated approvals. I'm going to widen the question a little bit though, because I think this question really is about account-based marketing and white space. And Robyn, you probably are a good person to start on this question because I think you started to tickle this idea, which is when you're looking at a large pharma, especially, if you take your concept of Pfizer and you've got people who are maybe on different therapeutic areas, maybe somebody's in oncology, somebody else is in pain. What are some of the best practices that you've seen for people who are using that account-based marketing approach where people might be assigned into different areas or with different products?
So I'm going to say, ask me in 6 months, I'll have a better answer because we are implementing a new solution with ABM. But I'm going to keep it a little bit more on my side of the wall than our marketing team, which is data, data, data. If you're going to get an ABM, get one where you can buy the right data. Make sure it fits your needs. So for example, the one we're buying gives me my parent-child relationship, which is amazing. So I don't have to do all of that. And then when you're assigning out accounts, you can look at the entire stack of, let's say, who does AbbVie or whichever AB it is these days, who owns everything else, right? AstraZeneca, oh, they own MedImmune. And so you can look at that also to determine where you want to put your sales team in. But it is a different sales strategy. And as I said, we're implementing an ABM solution right now. So I will have a better feel for it in 6 to 12 months.
Scott, I know you've got experience looking in white space and, also taking into consideration the global sales approach. So I'd love to hear your thoughts on this as well.
Yeah, I think there's the parent-child aspect of it when you're looking on the buy side, but then on the sell side, it's also role-based things and the ability to configure on role basis. And then in terms of the white space, the gaps, the different things that may come up with different global solutions, having your configurations able to accommodate that, whether it's currencies, whether it's language documents, all of those types of things, if you can anticipate that and build to accommodate those types of requirements that are going to be in a global life science, scenario, it'll pay dividends to do it proactively versus reacting to it and having to sort of put patches along the way as you discover, oh, now I realize, these integrations need to be in place.
Tarra, any thoughts on your side about this white space approach?
Yeah, no, I think they've hit on everything. Really putting that plan together, anticipating, specific, user role assignments, because in larger accounts and even in smaller accounts, you're going to have multiple people selling in. And so to be able to, understand what inside sales or account management may be doing versus business development versus a strategic person, that can all be captured and just thinking through how do you assign those and what are folks' roles. And it all comes down to who eventually gets credit for that sale, and is that split or whatever that may be. And so it typically starts with inside sales and blossoms from there. Yeah, completely agree. It takes some thought and planning, like everything that we do.
You just made my palms sweat a little bit, Tarra, because I can remember I started working with Salesforce in 2009. The concept of splits was foreign in terms of Salesforce. And it isn't now. Now you can definitely account for it. But
look how far we've come. You can split it 20 ways if you want.
Thank goodness gracious, because that is a pervasive issue in life sciences, as I'm sure other industries, but my goodness.
Yes.
That was a big relief when that came through. The last question that I have, and I'm going to read it verbatim because I love it, is what is the craziest thing you've ever seen in a Salesforce instance? LOL.
The tough one.
Craziest.
That is a great question. I'm not sure how I'd answer it though.
Eric, you can feel free to answer this one too.
I don't think this is one I've actually seen, but I know I've heard someone else answer this question. And what they were seeing was that someone had created a custom field or custom object with the same name as a standard one. And you just have to wonder why, right?
Search term on Google is Google.
Yeah.
I think I've seen dummy data make its way into sort of real workflows. And that just has some humorous outcomes, but
testing in production.
Yeah.
Also wiping your sandbox before you move your new stuff into production.
Oh, ouch.
That's fantastic. I know I've seen some roll-up fields, some opportunity roll-up fields to try to predict what do we think this is going to be based on when we think it's going to close. And then the reporting was still pulling off of the native Salesforce amount field. So those are, that causes some consternation for sure. This is awesome. This has been incredible. I want to thank all of you so much for joining us. We have had 100% retention rate in our audience, which is amazing. I am so pleased that everybody could join us. I want to thank every one of our speakers. I'm going to run around really quick and ask, where can everybody find you? Where can they find you if they want to interact with you, meet you, learn a little bit more about you? Remind everybody that I will be sending out an email to you, inviting you to our Life Sciences Dream In events in 2023, which we are absolutely thrilled to be able to work on and sponsor. And I want to wish everybody happy holidays. Eric, where can everybody find you?
I am on LinkedIn and Twitter. If you just search for Eric Dreshfield, I'm the only one out there. Should be easy to find me.
You sure are. Robyn, where can everybody find you?
I am just on LinkedIn, Robyn with the Y, Goldstein.
Awesome. Scott, where can we find you?
LinkedIn's the best place.
Tarra Shingler, where can everybody find you?
Yes, LinkedIn, Tarra with 2 R's. There's not many.
Awesome. Thanks everybody for joining us. This is exciting. 2023 is bound to be an action-packed year in the life sciences. Salesforce is poised to help us with so many of our problems. I want to thank you. I want to invite you to join us again in January, where we will be doing a webinar on automation. In February, where we're going to be doing an amazing exercise on working on your go-to market approach and how to make sure that that is streamlined for your Salesforce effect. And in March, we're going to be having a demo jam, which will be awesome. I'll see you all then. Happy holidays.